Chapter 1 of Healthcare Core, and this is some of the things that our teacher has said star on our book, which you guys know means very critical for your exam and very critical for you to memorize. So I'm going to go through my book. Excuse me if I'm going kind of slow, but I'm just looking through the book to make sure I get all the stars. First, I need to look at my syllabus and see exactly where I am and what I gotta study by the time I go back to class. When we go back on the 3rd, we're gonna have our first math quiz, and I'm definitely not ready for that. On the 5th, we're gonna have our HCC exam. For HCC, the first test that we're going to have, the first exam that we're going to have is on chapters 1, 2, 3, and 4. She did say something, and it was the fact that if we did the workbook, we could go ahead and count on everything on the workbook to be on the exam, and trust me, that sounded like a major star. The first thing on chapter 1 is Dorothea Dix. Who is Dorothy? We basically have to know the names of these people. The first person is Dorothea Dix, and what she did was a pioneer crusader for elevation of standards of care for the mentally ill. That was Dorothea Dix. Then we have Clara Barton, and Clara Barton was the person who developed the Red Cross in 1881. Next is Marianne Ball, and she was the person who campaigned the rights and comfort of the soldiers, things like organized kitchens, laundries, and ambulance services. Next we have Linda Richards. Linda Richards was the first American nurse. She was credited for the development of our present day documentation system. Isabel Hampton Robb was the one who organized the first graded system of theory and practice in nursing schools. We have Lavinia Dock. Basically, she was responsible with Robb for the organization of the American Society of Superintendents of Training Schools. She it evolved into the National League of Nursing Education. That, when I see National League of Nursing Education, that's the key word for me. It's for me to remember it. Next, we have Mary Eliza Mahoney. She worked for the acceptance of African American nurses in the nursing profession. So she was basically the first African American nurse. Lillian D. Wald. She was responsible for the development of public health nursing in the United States through the founding of Henry Street Settlement in New York City. Mary Adeline Nutting. She developed curriculums, concepts, and guidelines for student nurses. Mary Breckenridge. She was the pioneer in nurse midwifery. Very important to remember those people, those 10 ladies. Identify the role of the National League of Nursing, the LNN, in nursing education. National League of Nursing makes sure that nurses are being held to a certain set of standards in education. This the purposes for the National Association for Practical Nurse Education, NAPNES. So the purpose for the NAPNES and the National Federation of Licensed Practical Nurses, that's NFLPN. So the purpose for those two, if you guys remember those two keywords, is basically to provide education and practice to the LPN, LVN, and set standards as well as accreditation. So they set standards as well as accreditation. That is the L for LPNs and LVNs, and the leagues are NAP, NES, and also the NFLPN. Who are the people who basically determine the responsibilities of the LPNs and LVNs? It is the council, keyword being the council of the State Board of Nursing. That's the council. The people who determine the questions and the standards of the NCLEX PN are the State Board of Nursing. Recognizing patients as individual and making sure that they receive quality care is ensured by nurses providing care according to the patient's Now we're going to do some multiple choice. You guys have to remember these because they're going to be very important on the test. It says, one of the major problems of the hospital of early 19th century has been addressed by which measure in contemporary healthcare? That is, using standard precautions to address hygienic practices. Which patient typifies the demographic changes of the population in the 21st century and represents an increased need of nursing care? That is, a 70-year-old woman with chronic illness. Basically because people are living longer nowadays. So the more we're studying, the more we're learning, the longer people are living. So we're going to need more nurses in the future. That's what that basic concept is. It says, which nursing action reflects Florence Nightingale's vision of how to improve patient care? She believed in education, so basically the answer is that attends an in-service to learn a new infusion pump. So anything that basically is gonna say something about education. She believed in nurses further educating themselves to provide better care for their patients. It says, which situation includes the four major concepts that are the basis of nursing theories and models? The answer is, the home health nurse assists a patient's health and home setting. Which patient is most at risk of being the medically underserved in the United States? A 65-year-old Vietnam veteran who lives on the street. Utilizing Maslow's hierarchy of needs, the nurses gives priority to which problem? Just so you guys know, Maslow's hierarchy. I'm going to show you guys. For those of you who don't remember, because it's important for us to remember this on our test, it's Maslow's hierarchy on the hierarchy is physiologic. If a patient is can't breathe, basically your ABC, which is airway, breathing, and circulation. First, you need to make sure that you could make that all of that is clear. The nutrition, elimination, and oxygenation, like I said, the ABC, and sexuality. If a patient is hungry and you're trying to teach them do something else for themselves, they're not going to be paying attention, because if you got to pee, you're not going to be paying attention. If you're hungry, you're not going to be paying attention. You got to make sure that their physiologic needs are met. That's number one. The next one is safety and security. Stability, protection, and security. They don't want to feel anxious. They don't want to feel afraid. You have to make sure that those needs are met. Then is love and belongingness. That's basically acceptance by their peers and affection. Then goes esteem, which is self-respect, self-confidence, and feeling of worth. And then the last one is self-actualization. And that is full use of individual talents. A patient, our goals as nurses is to make sure that by the time we dismiss our patients to go home, they could do their care on their own. They're able to inject their own insulins. They're able to walk to the bathroom on their own. And this is within reasonable manner. You know, somebody who basically is wheelchair bound is not going to be able to do these things, but you want to make sure they can do as much as they can on their own. So that's the last one, which is self-actualization. So now that we know that, the option for the which needs, it says utilizing Maslow's hierarchy of needs, the nurse gives priority to which problem. It would be inability to eat because of difficulty chewing and swallowing, which means that their physiological needs are endangered. They can't eat, so they're going to be hungry, so they're not going to focus, so nothing else matters. If they don't eat, they'll starve, they'll die. So it says, a mother tells the nurse of her 17-year-old son who is wheelchair bound for 1 year following an accident. He has been depressed because basketball season is starting and he has a star play, and he was a star player of his high school team. Utilizing Maslow's hierarchy of needs, which intervention would address the son's priority? It would be for us to suggest the mother and son to seek out wheelchair basketball teams. Basically, this is part of Maslow's hierarchy, and that would be love and belongingness. Once again, he's going to be part of a team. He's going to feel like he belongs with his peers. The nurse has identified that a 56-year-old woman has an increased risk of heart problems because of family history. Which modifiable factor should be included in the teaching plan to promote health and self-help practices for wellness for this patient? Select all that apply. That'll be the first one is smoking cessation and stress reduction. So she has to stop smoking and reduce stress. The second one is going to be the weight reduction and decrease the alcohol consumption. And the third one is going to be to control over decision making that affect your own body and health. So basically, you're going to educate her more on her health and how to maintain. Which task should be assigned to a UAP standing for Unlicensed Assistive Personnel, who has been cross-trained as a unit secretary? And that would be to ambulate patients and order unit supplies. Which action best demonstrates the nurse's consistent effort to contribute to the cost containment? That would be uses time and materials. The nurse is caring for a patient with immobility related to chronic
musculoskeletal disorder. Using Orum's theory of nursing, the nurses would be monitor the patient's self-care defects. What are the defects? What is going on? What are the problems with that patient taking care of themselves? Excuse me. A nurse is caring for several patients on a medical surgical unit. Which action or actions indicates that the nurse is providing care that adheres to the patient's Bill of Rights? Select all that applies. So if you are adherent to the patient's Bill of Rights, that would be on page 15. Patient's Bill of Rights. In 1972, the American Hospital Association, the AHA, issued the Patient's Bill of Rights in an effort to ensure that the patient's fundamental right for treatment with dignity and compassion are fulfilled. All right. So here it says the answer for ensuring that the nurse is taking care of the patient according to the patient's Bill of Rights would be to ensure that the housekeeping staff employs the trash receptacles in a timely fashion. That's one. To assist the patient to make a list of questions to ask the surgical procedure. And that's two. Number three is identifies a problem with broken side rail and contacts the maintenance department. Number four is keeps up to date with the latest information on medication and side effects. An intoxicated patient comes in the clinic and verbally threatens a nurse with bodily harm. The nurse refuses to take care of the patient and informs the supervisor about threats. Which document and concept supports the nurse's right to refuse care of this patient? That would be the healthcare provider rights. We as healthcare provider also have our rights, and that is on page 16. It says, the delivery of healthcare has to be a process of mutual exchange between patients and healthcare providers. Patients accept their rights as just outlined to be respected, but healthcare workers have the same expectations action as well. Is outside the scope of practice for LPN or LVN, and that would be makes independent decisions about nursing diagnosis. I'm sorry if my energy is kind of low. Like I let you guys know in the previous videos, I am fasting. I am on a liquid fast. I'm fasting from food, so I'm only intaking liquids. I am low on energy, but I'm doing my best to bring you guys these videos because I know they're very important to study. We have 4 chapters to study. This is 1 out of 4 for healthcare core. And yeah, I hope I didn't bore you guys. We have 3 more videos to go. Alright. The first one, as you guys know, the first theorist, nursing theorist, was Florence Nightingale. She was under the guidance of Theodor Finder, a German pastor in Kaiserwerth, Germany. Very important, Kaiserwerth, Germany. Theodor Finder, a German pastor. The Lutheran Order of Deaconesses established the first school of nursing in 1800. The reputation of the school soon spread through Europe. It reached a young woman in England, Florence Nightingale, whose interest in nursing spurred her to overcome the oppositions of her family, her friends, and social class to which she belonged. Alright. Just so you guys remember, key point that the teacher said was the fact that we do need to remember that before nursing was a professional, before nursing was a profession, it was known as something that was only taken by prostitutes and those women who had basically no respect for themselves and who didn't maintain themselves at home. Florence Nightingale was the first woman who actually made nursing a profession for everyone else and set standards. And basically she came in, and let me tell you guys, it says here, my next star, it says Nightingale nurses improve patient care by such measures as good hygiene, sanitation, patient observation, accurate record keeping, nutritional improvements, and the introduction and use of new medical equipment. The demand of their services were overwhelming. So basically they didn't have all that. You went into hospitals, they were known as pest houses. Star hospitals were known as pest houses. And there were places that people would go in when they were sick and would never come out. You would basically go into the hospitals to die. A surgeon was known best. The more blood that you had on your aprons, the more of a better surgeon you were back in the day. Surgeons would actually come out of doing surgery full of blood, and they would deliver babies, and there was a lot of mortality within the babies that were born in hospitals. That's why a lot of women rather have their babies at home back then in the 18th century. But Florence Nightingale came in, she opened up the windows, she cleaned up the patients, she fed them well, and things that we consider now to be just basic care never existed. They would be, they wouldn't clean their wounds, they wouldn't clean infection sites. They would put 2 or more patients in the same bed together, and it was just very disgusting, and that's why they were considered pest houses. Until Florence Nightingale came in and basically improved healthcare for everyone. You guys know about what the women of nursing did. Looking for another star. It says another star. It says duty of licensed practical and licensed vocational nurse. In 1944, the United States Department of Vocational Education compositioned an intensive study for practical and vocational nurse tasks. The outcome of the study differentiated the tasks performed by LPN, LVN in relation to those tasks performed by the registered nurse. As a result of this study, individual state boards of nursing began to specify the duties and responsibilities that could be accomplished by each of the groups. Another thing to remember is that we do the NCLEX PN. That's another star for you. Another thing we do need to know, star is Nightingale. Nursing objective of Nightingale is to facilitate the body's reparative process by arranging the patient's environment. Setting is patient's environment is arranged including appropriate noise control, nutrition, hygiene, lighting, socialization, and hope. Orem, as we read for him, is his nursing objective is to care for and help patient attain self-care. This is self-care deficit theory. Nursing care becomes necessary when patient is unable to fulfill biologic, physiologic development, or social needs. Nursing objectives: to provide care consistent with nursing's emerging science and knowledge, with caring as central focus. That was Leringer in 1978. The setting in this transcultural theory, unifying domain for nursing knowledge and practice. So caring for your patient is very important. As we all know, our teacher always says creating a nurse-patient relationship is very essential to doing your job right. All right. The nursing objective of Roy is to identify types of demand placed on patients, asset adaptation to demands, and help patient adapt. The setting is, this adaptation model is based on a psychologic, physiologic, sociologic, and independence adaptive. Paris is P-A-R-S-E in 1981. His nursing objectives was to focus on man as living unity and man's qualitative participation with health experience, nursing as science and art. The setting is man continually interacts with environment and participates in maintenance of health. Health is a continual open process rather than a state of well-being or absence of disease. Benner and Rubble. I will let you guys see that because I don't know how to pronounce it. We are down here. Okay. And their nursing objectives was to focus on a patient's needs of caring as a mean of coping with stressors of illness. Their settings is caring is central to the essence of nursing. Caring creates the possibilities for coping and enables possibility for connecting with and concern for others. So once again, caring is very important. Alright, so let's take it straight to the NCLEX questions, because some of these NCLEX questions are going to be on the... Alright, so NCLEX. Question number 1. A prospective nursing student questions what program accreditation means. What should be included in the information provided? And that is, accreditation is a voluntary review by a given organization to determine whether the program meets organization's pre-established criteria. Number 2, the nursing student is discussing the impact of preventive medicine, which change has resulted from this focus. And that is knowledge and service to promote health and prevent illness. What is wrong with me? It says, knowledge and service to promote health and prevent illness. The wellness illness continuum. Number 3, growth and advancements of the nursing profession in the 21st century can be attributed to better education for nurses. Number 4, nursing education program may seek voluntary accreditation by which agency? Star. Accreditation can be attained by the National League for Nursing. Number 5, when developing a definition of health, a person considers that health is a condition of physical, mental, and social well-being and the absence of disease. Number 6, which philosophy is described as comprehensive or total patient care that considers the physical, emotional, social, economic, and spiritual needs of a person to the person's response to illness and the impact of the illness of a person's ability. Honestly, that's a mouthful to say, but basically the answer is holistic nursing. And what you need to remember is the fact that they mention spiritual. Once you mention spiritual in a nursing care plan, basically it's all, or nursing care, it's all holistic. So you're taking care, once again, you're taking care of a person's physical, emotional, social, economic, and spiritual needs. Okay. The student nurse reviewing the history of nursing knows that the lady of the lamp is, with my eyes closed, I could always say male, was known as the lady with the lamp. The American Society of Superintendents of Training Schools of Nursing was established in 1894. What was the major goal of this organization? It was to set educational standards for nurses. Nurses correctly recognize what as a key determinant of the scope of practice. That is the Nurse Practice Act. Number 10. Nursing theorists are helpful in enabling the nursing profession to problem solve and establish standards. Who is largely recognized as the first nursing theorist? That is Florence Nightingale. The most commonly used model that assists in the understanding of patients' place of wellness-illness continuum is that of Abraham Maslow. Abraham Maslow, there was a lot of wellness-illness continuums created before, but his was the most accurate. Which person was the first nurse to train in America? Linda Richards. Which was the first school dedicated to the training of practical nurses in the United States? That was the Ballard School. Star. The Ballard School was the first school dedicated to training practical nurses. The Ballard School. What is health? Health is a state of complete physical, mental, and social well-being. When reviewing a role impact of men in nursing, which statement is most correct? Men are regaining their historical position in the profession as nurses. Number 16 and final question. The nurse is reviewing the planned health promotion activities for local community center. Which primary prevention activities may be included? That is a dietary teaching focused on the prevention of obesity. Primary care is prevention.
Alright, y'all. I love y'all. Done. Deuces. Done. Tired.